As many return to school or the office for the first time in months, it could be stressful for many. Here's News 8's Lisa CARBERG with more.
For a lot of Connecticut residents, this month will usher in a transition from remote working to being back in the office in person. Here to talk about the stress and how to cope with it is Dr. Jennifer Ferrand, a board-certified clinical health psychologist and director of well-being at Hartford Healthcare. Welcome.
Thank you.
So what are some of the stressors that people are facing as they head back into the office?
Well, there was a June survey of over 1,600 workers that indicated that 1 in 3 people were experiencing mental health problems when they returned to on-site work. And most of these problems include things like anxiety, depression, and burnout, which is a work-related syndrome, including things like cynicism, depersonalization, and reduced effectiveness at work. So the biggest stressors that people are experiencing are things like concerns about physical health and safety. We may experience anxiety about getting sick and possibly communicating illness to family members, particularly kids that are unvaccinated. And other stressors, including that happen when we go back to work, include concerns about losing the autonomy or flexibility that you might have experienced when working from home, concerns about schedule changes, or having to suddenly deal with a commute again. And what happens when stressed employees come back to work is that they're more likely to take on a reduced workload, and this can lead to staffing problems for employers.
That's a lot to think about. Wow. All right. What are some of the tools to help with any anxiety during this transition?
Well, I think the best thing that people can do is take care of their mental health and protect your physical safety. So you can always ask about access to mental health resources in your workplace, and you can communicate to your coworkers and your supervisors to identify things that cause stress and to work together as a team to identify solutions. We should also all be prioritizing safety, understanding your employer's safety protocols and abiding by them will help improve the comfort and safety for everybody. And I think people shouldn't be afraid to ask for what they need. Flexibility is key when we're going back to work, and employers would be best to be sensitive to people's needs for flexibility and autonomy. So, asking for things like mental health care on site or flexible schedule could help.
All right. What about managers in the workforce? What should they be mindful of as the return to the office gets underway?
I think that managers should be aware that returning to a new normal is not an overnight process, and they should think about it as a slower transition that will take some time for people to adjust to. Leaders should recognize that policies that increase workplace safety or promote flexibility and autonomy can help reduce their employees' stress. And they should be communicating clearly and frequently about important things like any policies and procedures they've put into place, any safety protocols. They should recognize that different employees have different needs. They should communicate that it's valid to have mental health concerns when you go back to work. And they should address stigma, I think, by implementing inclusive policies that are supportive of people's well-being. They might also be...
All right, we are out of time, but thank you so much for this great advice as people prepare to return to the workforce.
Great, thank you so much.